Welcome to the Retirement Roadmap by SHP Financial, a podcast empowering today's retirees and pre-retirees to make well-informed financial decisions that will help you spend more time living and dreaming than worrying and wondering. Join me, Matthew Peck, along with my co-hosts, Derek Gregoire and Keith Ellis, as we share actionable financial strategies and insights, as well as interview top thought leaders in the world of finance, accounting, and estate planning. This is all aimed at preparing you for the retirement you've always dreamed of. Our high-quality holistic planning process has helped thousands of families retire and create what we like to call the ripple effect. The Retirement Roadmap is your guide to financial freedom. Are you ready to get started? Let's go.
Welcome, everybody, to the Retirement Roadmap. We're joined here today by Scott Hokanson. Now, Scott Hokanson is a 27-year veteran in the Massachusetts health insurance industry. He spends most of his days helping small businesses and individuals navigate the health insurance marketplace, and he is here today to discuss Medicare and things beyond. Scott is licensed as both a Medicare supplement and Medicare Advantage expert and helps SHP clients when they're approaching retirement age navigate this crystal clear, right, Scott? Exactly. Crystal clear, easy to understand system. This
job security for me.
Yeah, exactly. We're also here joined by Matthew Peck, my business partner, CFP, co-founder of SHP.
Yeah, you know it.
Co-founder of SHP. So obviously, one of the main questions that we get asked as people look to navigate and get closer to 65 and look to transition from what I call traditional healthcare to Medicare is, what's the best place to start, I guess? Where do you go besides calling Scott? What's the next best place to start?
The best place to start really is just understanding, and this is part of your guys' whole retirement plan. A big part of the retirement plan is their Social Security and other benefits that they've paid for their whole life. If you ask me what health insurance costs today, I would say on average, my clients pay about $800 a month for every person that's on health insurance. And that's for a plan that's really not very good right now. $2,000 deductibles, co-pays, big prescription co-pays, and what have you. But one thing that most of your clients, if not all of your clients, have done is they've all paid their Medicare taxes, as is their employer, for the last 30, 40 years of their working. And what that gets them at age 65, this does not happen if they start collecting early. That doesn't trigger it. But at age 65, or their Social Security normal retirement age, like for me, I think it's 66 and a half or 67, that gets them access to Medicare Part A. If you think of health insurance and how health insurance has evolved, Part A was the first piece of Medicare, and it essentially covers the big stuff, the hospital stuff. And that's worth about $500 a month. Okay, so the reason why looking at Medicare as opposed to COBRA or your employer plan is because you're getting something for free, and I have air quotes here if you're hearing this on the the radio. You've paid for it. You've paid taxes. Your employer has matched every dollar of that tax since you've been working, and at 65 you get Medicare Part A, and that costs you nothing. And if you do nothing else, Medicare Part A is actually pretty good insurance. It covers the big stuff. If you got cancer, you have a hospital stay, it's going to cover 80% of that bill. Okay? Mm-hmm. Now, health insurance has evolved. We started at MRIs and CAT scans and stuff like that. So now they've created something called Medicare Part B, which you have to choose to elect. And that's the cost of Part B. You buy that from the government, and that is varied based upon your income from 2 years ago. So they look at your tax return from 2 years ago, and then based upon how much money you made, they then charge you a dollar amount for Part B. That, once again, supplements what's on Part A. Then you have the decision, do you want to buy a private plan or not? And 95% of the people we meet with do choose to buy a private plan. There's some incentives to do so, because if you don't, there's penalties later on and what have you. And those can range from $0 a month to $200 a month for a Cadillac plan. Mm-hmm. And the reason why an insurance company can only charge $200 versus the $800 when you were 64 years old is because they're only making up what Part A doesn't cover and what Part B doesn't cover. Do you see what I mean? So, yes. Like, you've worked your whole life for this stuff. when you choose to select your Social Security check, that's a big part of your guys' financial plan. Also, whether you tap into this $500 a month benefit per person, is entirely up to you. And what a lot of people don't realize is they can do it while they're working, they can do it after working. But a lot of people that are working, they might be paying $500 a month for a worse plan than what they have through Medicare.
Well, and that's the thing, Scott. So let's unpack that a little bit, because I do want to go back to the penalties. I think the penalties, people, they always come in and penalties are there to motivate us, to incentivize us to get onto a plan when the insurance companies or when Medicare, which is basically a government-run insurance platform. They're pushing us and nudging us to do something. So let's talk about the first is the income penalty. And kind of, if you don't mind, for our listeners, kind of explain that. And then also I want to talk about the late enrollment penalty. Because we do have a lot of questions when it comes to, hey, Matt, hey, Keith, I'm still working and I'm 66. What do I do? Do I go on to Medicare? Do I not go on to Medicare? So that's what I mean. If you could just go into those two areas a little bit more.
Sure. So the income penalty is the most frustrating one when I meet with people. Because once again, they've paid their taxes, they've paid a percentage of their income, their higher income their whole time, but still when they go on to Medicare, there is an incredible difference in what the monthly premium is for Part B. Once again, you have Part A, which is free, but Part B has a variable premium based upon your income. If you're a couple and you make less than $176,000 this year, the cost is $148, $148.50 a month. That's
per
what it
person.
costs per person.
Yeah,
right.
okay.
Everything in Medicare is per person.
Okay.
So there's no couple plan. It's always per person. So everybody gets their own benefit. But if you make $250,000, that $148 grows to $328. If you make more than $500,000, then the price goes to $568. So you can see they're paying $400 a month, almost $5,000 a year for each of them.
Right.
You know what I mean?
Person.
There are times where I sit with a couple and they might work off of two different checking accounts, and Mary's income is higher than Joe's income, and Joe gets mad at Mary because he gets the penalty too. It is, and I say, listen, she comes as a package, you got to take it, So if you're filing jointly, they look at your joint income.
And so, in about that, so literally 2 years. So let's say someone retires at 63. They're a CEO or whatever it is. Here they are at 63, earning a fair amount of income. Then they retire, and at age 64, they earn nothing, let's just say, just for argument's sake. But at 65, they're paying the higher penalty because of that 2-year lag.
An even more frustrating example is, what if they sold their lifetime house?
Okay.
Correct.
Yeah.
One-time event.
Yeah. Yep.
You know what I mean? IRS counts it.
Mm-hmm.
There's no exemptions for
There's
that.
no exemptions like that. They sell a business.
It is what it is.
Oh, I got one check, and Uncle Sam got a huge chunk of that then too.
Yeah.
You know what I'm saying? Because they didn't meet with you guys early enough.
And they reassess that. They reassess that every year.
It does reset every year. It's a 1-year sentence, and I kind of use the 1-year sentence as both a choice. I have essentially two types of products that we recommend to clients. One's an Advantage plan, which for all intents and purposes costs between $0 to $30 a month, depending on the county you're in. A supplement, which would be the Cadillac plan, I guess, is $225 a month. So there's your variable, okay? The zero premium plan is endorsed by AARP. It's United Healthcare National Network. I try and convince people, I said, take the less expensive. It's a 1-year sentence. If you're healthy, once again, if you've got a ton of stuff and you're fighting and you really want no referrals, great, buy the Cadillac. But 75% of my clients take that zero premium plan, and next year when we do the follow-up, they usually stay on it.
Sure.
And it's a 1-year commitment. So God forbid my wife finds a lump and she really wants some more freedom of the supplement plan. And that's really the difference. We can go through copays and deductibles, but the major difference is a supplement lets you go anywhere in the country that takes Medicare. and an Advantage plan is going to limit you to a network of doctors.
But that's interesting. Yeah. So, Keith, kind of for all of our listeners, it's like an interesting kind of, recommendation there, and everyone's situation's different and unique and, and all that stuff. But it's more the idea that, okay, since it is really a 1-year sentence, if, for any of our listeners that are facing that penalty, that 1-year, sentence, and you're in sort of penalty jail and paying significantly higher Medicare Part B premiums, potentially take that year off, go for a lower priced a Medicare Advantage plan, which, as you were saying, Scott, like, I look at some of these benefits too, and remember as I was sort of, coaching people on, the transition to Medicare, they say, oh my goodness, it's, $25 a month. I mean, I must get, terrible coverage. And it's like, whoa, you'd actually be surprised that when you compare with the pre-65 plans, or as you were saying, Keith, at the beginning, kind of like normal health care that people expect. I mean, even these lower priced Medicare Advantage plans are equal, if not better.
And they're certainly better than what I've sold their employer. Okay, so and that's that's why I've done health insurance for 27 years, but I only started doing Medicare about 6 years ago, and that's because even with the employer paying half the premium, anybody over 65 is usually better off leaving the employer plan and paying the whole premium themselves for Medicare. And the reason why is because for $148.50, that most people making under $175,000, that group of people, they get Medicare A and B, something worth $650 a month out of their Social Security. They're getting something of such value from the government. And once again, there's one thing that everybody that's on Medicare does every November. They vote. Okay? Nobody's messing with this. Okay? When you talk about, is the plan good enough? The $29 plan, it's not really $29. It's Part A at $500, Part B at $150, and Part C, D, whatever you want to call it, whatever mine is, at $29. So you're really at $670 a month plan compared to what their employer was paying $800 for.
Interesting.
And you have the government's buying power that bought all this.
Yeah.
Okay. Now this creates an interesting question that we can talk about or not, but. So why don't we all do this? Why doesn't Medicare just cover health insurance for everybody? Why don't we have health insurance?
Oh, man, here we go. You're going down a rabbit hole here, Scott. But all right, go ahead.
The reason is because there's a hidden tax that people don't know about. Medicare doesn't pay our doctors and hospitals enough. Mm-hmm. If a hospital only had Medicare patients, they'd be out of business. They don't pay the hospital, they don't pay Beth Israel here in Plymouth enough money to stay in business. So Beth Israel has to charge Blue Cross, Tufts, Harvard, United Healthcare on the employer side more money. So there's another hidden tax out there for the working people that are paying for health insurance because Beth Israel has to make up the shortfall of Medicare by charging ABC employer more money. And that's the frustrating part of it. That's why national healthcare won't work and this kind of stuff. But we're not going down that rabbit hole like you said. But my point is that a lot of people think they have to wait until the end, until they retire to access this plan, or they're super worried about these penalties. The penalties are avoided 100% if you have creditable coverage. So you're still working and you have good coverage. You do not have to leave your plan at 65.
Well, and that's exactly, So now we completely explained, and thank you for that, talking about the penalty of higher income, and as you were saying, Keith, about they sell their home or what have you. All right, so let's talk about the late enrollment penalty. Yep. So how does it apply? When does it apply? How do you avoid it? Because we definitely get a lot of questions on that.
Yeah. So And one of the things I'm most frustrated about my industry is we highlight this penalty relentlessly to people about approaching 65. And the not clear on there is an explanation, but if you have creditable coverage, the penalty's waived. Mm-hmm. The government's doing what it thinks is right, and it's saying, listen, if you don't do this, you can get penalized. We want you to help avoid these penalties. So everybody gets worried about it. But the penalty is waived if your employer-sponsored plan is creditable coverage, which for 98% of people in Massachusetts, if you have an employer plan based in Massachusetts, that is the case. One area where it might not be the case is if they're on a health savings account. Okay. So health savings accounts typically have a health savings account typically has an automatic They are compliant, the MCC compliant, but sometimes people think they're on a health savings account, but they're on just a high deductible plan that is not technically a health savings account. And so there's sometimes where somebody says, "Oh, I'm on an HSA." Well, let's look at that, look at that clearly, because if it is a licensed HSA plan, it is compliant. But sometimes people are just on a high deductible plan, and in their mind, somebody told them it was HSA compliant or something like that, and that's where sometimes we see people getting penalties.
So, if you're listening to this and you want to reach out to Scott to get some help, visit BraboInsurance.com, BraboInsurance.com. Scott Hokanson is the owner / Medicare expert here joining us today. Scott, you just mentioned something that I think, I'm actually starting to see more and more folks as they come in, families that we're working with come in, they're actually saving this way, and that is HSAs. So I was wondering if you could expand on, that, like maybe how they work, the power of them, the pros and cons, because I really think, they are available to folks. People don't really know what they are. They don't know if it's an advantage to them. They don't know if they should be taking advantage of it. And I think maybe in some cases, or maybe in a lot of cases, they should be.
Sure. So for instance, and once again, I'm not the financial planner here, but to me, I think HSA is the second best place to save money. 401k, number one. If you're working, then HSA, because it has triple tax advantage. The money goes in tax-free, it grows tax-free, and it comes out for the right reasons tax-free. And the right reasons are medical. It has medical, dental,
qualified
vision,
medical expenses.
Right. Section 213 of the IRS.
Oh, here you go. Did you get that? 213, Keith. You write that down? All right, here we go.
It's the same list for flexible spending accounts and whatever else. But the way an HSA works, remember I said that most employers, an average employer pays $800 a month for a single plan. That single plan has a $2,000 deductible. Okay, a health savings account would only cost $600 a month. And it has a $3,000 deductible, but it has one big difference. That $2,000 deductible plan also gives you office visits for $25 and prescriptions for some copays. The health savings account does not. Okay, you go to the pharmacy and your drug costs $100. You're paying $100 out of your $3,000 bucket that you have to do. But remember, you save $200 a month. Okay,
correct.
So if you put that same $200 into your health savings account, you're spending the same $800 you were before. Your net deductible is lower than it was before. And if you don't spend it, you keep it. Okay? So to me, you've got two choices. You can give $800 to the mean, ugly insurance company, or you give them $600 and give yourself $2. Okay? Now, the negative is when you show up at the pharmacy and they ask you for $400, you have to have it. Okay, because
be prepared to pay that bill.
Be prepared to pay that. So that's the negative, and that's why a lot of my lower income employees can't afford to do this because they don't have money in their paychecks at the end of the day. So to me, a health savings account is seldom the sole solution for an employer, but I love it as an option.
Yeah, and it's interesting because sometimes you'll see people in a health savings account, but then they never realize that they're supposed to fund the actual account, right?
Exactly.
So really what it is, it's a way to invest your money or grow your money however you feel comfortable, market, fixed rate. But you're right, you're putting money aside for you to use later in life. I've seen folks walk in with $50,000, $75,000, $100,000 in a health savings account, and they're like, well, this is my Medicare premiums for the next... however, or Medicare supplement premiums for the next however many years.
Well, that's just it. And I'm at the stage now where I'm 49 years old, so now I've got nieces, nephews, and kids getting jobs, and I'm now getting the calls from them. And the fun one, I had a nephew who took a job at a very large employer locally here that has amazing benefits. And
SHP Financial.
He was a C student.
Touche, Scott. Touche. Well played.
Wouldn't make the cut here, but he's a hardworking kid, and he maxed out his 401k, and then he was looking at his health insurance. But of course, I get the phone call, and he's old enough to buy me a beer, so I made him buy me a beer and bring it with him, and they matched half of the deductible. So he had a $5,000 deductible, but they also matched half of it.
Wow!
So he's getting $2,500, and he's a 23-year-old invincible.
Yeah, right.
You know what I mean?
Absolutely.
He might break his leg skiing once every 5 years.
Exactly.
Okay, so like I'm like, dude, just do this for 5 years.
Yeah.
And,
Put it away.
And then, when you're married, have kids, we may make a different decision. But even then, at that point, he'll have, he'll have $10,000 in there, assuming no market growth, and he's got a $5,000 family deductible. So if he keeps putting the money in, he'd never hit his deductible again.
Right.
You know what I mean?
Right.
So like I said, now this is a responsible kid with a good job, good salary, and he can afford to put his $200 a month in. It was $50 a week for him to put into this plan. And, he's got one of those jobs where they send him off for 6 weeks and gets a week off, so they're paying all his living expenses too.
Oh, man.
So it's just,
Where does he work? They hire him.
That is not SHP Financial.
That's right, exactly. But he's a safety guy, so he does.
Right.
He goes
Okay.
to projects. He's doing cleanups, and he's a safety guy. And it's just super interesting how with him before he has family or any other medical expense, I bet he'll have 10, 15, 20 grand in that account.
Wow.
And put things in perspective.
It's a great way to start.
Yeah. My wife and I have 5 children. We use medical care. Mm-hmm. We've been on a health savings account forever. And after all of our expenses every year, I've still got a good amount of money in that account. Now, what my wife and I do differently is if it's anything under $100, we just pay for it out of our regular checking account.
Well, and Scott, I was definitely, not to interrupt, I mean, that's the one extra part of it, because as you were saying, you can't stress enough the triple tax action here.
Yeah.
It's tax, you deduct it on the way in, it grows tax-free, and then it's tax-free on the way out. And my wife and I do something similar. Again, same idea, fortunate enough to do this, but in the sense that everything, I think, what's the family? Is it 7,000?
7,500, 7,550, I think this year.
Yeah, 7,550. So
Yeah.
it's like, Diana and I were putting in that full 7,550, and then, for just odds and ends, we're not dipping into the HSA and just letting that 750, whatever, 755, whatever it is, accumulate and certainly hope, continue to, obviously it goes up and down with the market, but 'cause that's the other part, Keith, that you said that I really want to make sure our listeners know. And the question I get a lot is like, okay, so it just sits in a bank account. And I'm like, no. You can if you want to buy Amazon, that's not a recommendation, just saying. You can buy Amazon stock. You can have a mutual fund. You can buy the S&P 500 index fund. I mean, you certainly should have some set aside in cash in case there is an emergency of emergencies. But this is accumulating. This is investing, and so it could just compound. And you're talking about your nephew. I mean, we all know. I think it was Einstein or Franklin just talked about the beauty of compounding interest. Yeah. I mean, that's like the 8th wonder of the world or whatever it may be. I mean, imagine that he'll probably have $200,000. When he's ready to retire.
Yeah.
And sorry, just to keep on going my soapbox, but I forget that Fidelity study where they're saying like, okay, most retirees are going to need like $250,000, to cover costs. Yeah. When deductibles and co-pays and whatnot. And so I mean, whether it's a 22-year-old nephew or anybody that's under 65, because I do want you to dig into that about how it's a little bit different. It's like you can only do an HSA until 65.
You can only contribute more money into it.
Okay.
You can only contribute qualified money until 65.
Okay, and then Keith, you mentioned it too, but it's like what always confuses me is that. So now let's say your nephew did it, right? Mm-hmm. He's now 65 years old. You can use the HSA money for Medicare Supplement or Medicare Advantage, or it's one or the other, right?
Correct. Medicare Advantage.
Only Medicare Advantage.
Correct.
Okay.
Not the supplement. So the Cadillac plan, you got to pay with post-tax dollars.
Okay.
So.
All right.
But you can imagine as you get older, things are going to happen. You're going to need that money
use
most
it.
likely.
Yeah.
No, listen, deductibles, co-pays,
Exactly.
and let's say you use it for the wrong reason. You buy a 1970 Corvette, like some people have done, all right, and you pay your taxes plus a 10% penalty. Okay, so it's like a 401k penalty or something like that.
Sure.
It's not like you don't have access to the money.
Right.
You pay the taxes
Okay.
you haven't paid plus a 10% penalty. So it's still your money. It's not the government's money. It's not your old employer's money. Health savings account is your money. It goes into your account, and you are vested 100% day one in any HSA deposit.
So as you can see, Scott is very well versed. Matt and I are over here scratching our heads like, how does in this industry. So again, to get a hold of Scott, and if you are looking for help on Medicare, health insurance, business health insurance, this is his focus. This is what he's been passionate about, him and his team for 27 years. BraboInsurance.com. Scott, we're going to transition here.
Yeah.
So many times folks come in and say, I'm on this drug or that drug, and the cost is through the roof. Yeah. Why are prescriptions, continuing to just be more and more expensive? I know Medicare, they have a plan as well. It's Part D. Am I correct there?
Which is included in the Advantage plans that I use.
So why are they so? Go ahead.
Yeah, so it's tough. The prescription plans on Medicare are just as bad as the prescription plans that I have for employer-based coverage.
Okay, so no one's safe, basically.
Nobody's safe.
Target on everyone's back.
I'm 49 years old, and I have arthritis. I have moved from Humira to Enbrel, so I'm now on something called Talls. Talls is over $2,500 a month. So if I retired today and I had to go on Medicare, I would be hit with the donut hole. Donut hole's a couple $1,000s a year that you get hit with if you're on expensive medications. So one thing that you should always be doing when you're considering, if you have access to employer coverage and you're considering transitioning to Medicare, I'm happy to do it for you. Or you just go on Medicare.gov, you put your actual meds in, and it spits out what your out-of-pocket costs will be, both for premium and for out-of-pocket costs, copays and deductibles and what have you. The site is awesome. And the clients of mine that have 20 medications, it actually creates a little number for you, so you never have to type that in again. You just type in that number, and it repopulates those 20 medications. And I tell you, when we're in that position, I had a situation where there's a gentleman on the Cape, and he just happened to use CVS, and he had a couple expensive meds, and it was just a killer for him. And he was retiring. He didn't have access to any other coverage, so we had to do Medicare, and we're looking at different options. But the town he was in Falmouth. I'm like, listen, let's just click off every pharmacy as an option. And for some reason, Walgreens, and I don't mean Walgreens versus CVS, one being cheaper than the other, but in this particular instance, there was a different national pharmacy that had a better contract for that drug than the one he was going to. And it saved him about $250 a month.
Wow.
You know what I mean?
That's big.
So it was real money. And
it definitely adds up.
And it was just doing that exercise and clicking a couple extra boxes. If we hadn't done that, it was one of those things where I had to email our team. I said, listen, guys, from now on, we're not asking people whose pharmacy it is. We ask their town and click them all. You know what I mean?
Yeah, because it's your job to get the best.
Forget about it. I used to ask people, what pharmacy do you like to use? I don't care. Like I would say, CVS on Pilgrim Hill Road in Plymouth, but there's literally a Walgreens across the street. I don't,
Which
let's
one's
just click
cheaper?
them all. Let's click them all.
Which one's cheaper? I'm going there.
Let's click them all.
Yeah, and also, isn't that the same with mail order or no?
Sure, mail order helps. So,
Okay.
And once again, you could have a mail order contract through Express Scripts or Silver Script or something else like that. So that would automatically be in there. So the way drug programs work is you're hiring one drug company to manage both your retail and your mail order. So you might be forced to use mail order, depending on some insurance companies, whether people like that or not. But the CVSs and the Walgreens have gotten better. They're now letting you dispense 90 days at the site for one copay and stuff like that. So
yeah.
The market's reacted to that. But I just encourage you, if you go on that Medicare.gov and you get stuck with some of those high out-of-pocket expenses, a nice little trick is to go back to the first page and don't click your one favorite pharmacy. Mm-hmm. Click your town. And collect, Stop and Shop. And
heck, I'll go to the next town if it's going to save me $250.
But click, any of these 20, pharmacies, and you'll see. And I can't say this enough, and this is especially true for, I'm sure, a lot of your clients. Vietnam-era veterans have a very unique relationship with the VA, and I can only appreciate that, and I can't understand it. They had a very different experience than I think a lot of the Afghanistan veteran have. And lots of times I'll meet with people, I'm going to get emotional here. Lots of times I'll meet with veterans and they don't want to use the VA. Mm-hmm. And they should. You earned it, you deserve it, and lots of times they can do it through mail, but have your wife go pick it up. If you don't want to show up there because of what happened when you came home, we understand, but you've earned it. Mm-hmm. And lots of times the VA, especially people in those situations that are on difficult medications, you might be able to get them free from the VA. And once again, the Vietnam era vets have a very unique situation, and I'm not old enough to understand. My father was is a veteran, and it's a very unique relationship. And I understand it's not as positive as it should be, but they have access to, they can get you the Enbro for free, and view it as you're sticking it to them for $250 a month, So I can only encourage, like I said, if you have a veteran and you ask if they're utilizing VA benefits and they say no,
encourage
try
them
and
to.
talk to them about
Sure.
it. Once again, I can only convince people to do so much.
But it does show, and I'm sorry to interrupt, Scott, because it's obviously an extremely important point, but it's like, so it really is multifaceted. So it's like, okay, so you have veterans, and they have their choices. They have the VA system, or they have potentially Medicare. Then you have, whether or not they're veterans or not, then you have people that are still working. And then they're also kind of in a specific situation because they should look at, okay, are the prescription drugs covered under the Medicare system, or should I stay on my employer plan? So it's like really everyone is in a unique, and then as you mentioned about what prescriptions they take are impacted by what pharmacy they go to and whether or not they do mail order. So
Matt, the easiest thing, call Scott.
Well, that's what I'm saying. That's kind of what I want to kind of try to put a bow on it.
Yeah.
In the sense of like, I guess it's just, because at the very beginning, Keith, you mentioned about, okay, where does someone start? I mean, I guess, is there any, really kind of like nice general rule of thumb, besides calling Scott?
No,
you're absolutely right, as to how people approach this situation, or is it really truly unique and everyone has to find their own path?
Yeah, obviously we're here to help. And let me preface this. We're here to help for SHP clients. I don't take appointments off the street. Okay, I take appointments from referral partners' clients. Okay, so that is a very important distinction. So you call our office and you say you're an SHP client, then you get access to me. But a really good place to start is that Medicare.gov site and put your prescriptions in if you're on a lot of medication. If you're on heart medication, cholesterol, you're good. Yeah. But if you're on something unique, do that Medicare.gov site and put your prescriptions in and see what you're up against, because that could be a couple $1,000 hit. Then also understand, Google Medicare income penalty. Yeah. And you'll understand better about Part B. And I should have brought this part up earlier. We are going to bombard you. We, being the insurance industry, is going to bombard you about these penalties if you don't enroll in Part B when you're supposed to. And there's a 10% penalty per year, all this stuff. If you stay on employer coverage, you should not elect Part B. Okay? So as long as you have creditable coverage, ask your HR person, send it to me, and I'll tell you whether you have it or not. But if you have creditable coverage and you're staying on it, there's absolutely no reason for you to elect Part B. Okay, and people do it out of fear because they got the penalty. They Googled penalties and all this kind of stuff, and they don't want them. I just transitioned a couple, from employer coverage to, he retired October 1st. And I have to get their Part A and Part B effective date. And they both had their Part B effective date of January 1st.
Wow, yeah. It's like you didn't
They wasted $300 a month for 9 months, and like they hadn't called me in the fall and whatever else.
Let me guess, the government gives it right back to them.
No, it's gone. The money's gone. It's so frustrating, especially higher income folks sometimes are, to be that successful, sometimes you have to be a type A personality. You don't read the fine print as much. Oh, I have to do this. Boom, press the button.
I have to get it done, right.
Okay, so they end up paying $500 a month for something they get no benefit from, because your employer coverage is always primary. Another good point is you're over 65, your spouse is not. Okay? That spouse, if you ever opt off your plan and you're covered by employer coverage, you going on to Medicare entitles your spouse to 36 months of COBRA versus just 18. So if your qualifying event was you leaving the employer plan and going on to going on to Medicare, your wife can stay or husband can stay on the plan for 36 months. So that spouse who's 62 has two choices: COBRA or a marketplace solution from a guy like me, which is going to be close to $800 a month for a $2,000 deductible plan.
That's fantastic. I already wrote that down, Keith.
Yes.
About something else, you learned something new. But so obviously, Scott, thank you so much for coming on. I mean, you could tell, and hopefully you can come back again, because I think we barely scratched the surface, honestly, on a lot of these issues. I mean, we were even talking about the wormhole of nationalized healthcare, or why our system is as sort of dysfunctional as it is. I mean, there's so much other areas to get to, and I think, and even the whole penalties and how you avoid them, and what's credible coverage again, and because I think those are just such amazing and great information for everyone to have, and just being able to synthesize it and kind of just really get it to just easily understood is just so important. So thank you so much personally, and I can't wait to have you on again.
Thanks a lot.
Thanks so much, Scott. Take care.
Thanks for listening to the Retirement Roadmap podcast by SHP Financial. If you've enjoyed today's episode, be sure to hit the subscribe button so future episodes are automatically downloaded directly to your device. And if you've liked what you heard, please share the show. Create your own little ripples so we can help even more people with their retirement goals. If you want access to all past interviews, including notes, resources, and exclusive content from SHP Financial, visit shpfinancial.com/podcast. Thanks again for joining us on the Retirement Roadmap podcast. And for all the attorneys out there, and disclaimers and disclosures, I'm just going to put on my super serious voice and add our own. No statements made during the Retirement Roadmap podcast shall constitute tax, legal, or accounting advice. You should consult your own legal or tax professional on any such matters. Information presented is for educational purposes only and does not intend to make an offer or solicitation for the sale or purchase of any specific securities, investments, or investment strategies. Investments involve risk, and unless otherwise stated, are not guaranteed. Our investment advisory services are offered through SHP Wealth Management, LLC, an SEC-registered investment advisor. Insurance sales are offered through SHP Financial, LLC. Our advisors and insurance reps may offer clients advice and/or products from each entity. No client is under any obligation to purchase any insurance product.